So my first question is, nasal valve is formed by, the options are upper lateral cartilage, lower lateral cartilage, lower end of upper lateral cartilage, and option number D is upper end of lower lateral cartilage. Okay. Now, what is the nasal valve? Nasal valve is the narrowest area into the nasal pathway, which is usually formed by medially nasal septum. Laterally, it is the turbinate, inferior turbinate, anterior most part. Okay, and it is formed by limen nasal, which is like upper lateral cartilage, lower border. So the correct answer is lower end of upper lateral cartilage. I'll show you how this nasal valve is formed. Now look at the diagram. This is the front view and this is the lateral view. Now you can see in between, this is my nasal septum cartilage. On lateral to that, there is lateral cartilage, which is also known as upper lateral cartilage, and lower to that, it is the lower lateral cartilage. Okay, got it? That is the major LR cartilage, you can say, or lower lateral cartilage. Now nasal valve, this is formed by limen nasal, or we can say this cartilage, upper lateral cartilage, lowermost part. So this is the lowermost part of the upper lateral cartilage, which forms the nasal valve. Then comes the septum in the midline and anterior end of the inferior turbinate. Suppose this is my one nostril and this is my other nostril. So in the midline there will be septum. From above it is lower end of upper lateral cartilage, and from the side it is the turbinate anterior most part, inferior turbinate anterior most part. So this area, I'll mark this area in the yellow color. So this area is my nasal valve area, which is the narrowest area. When we inhale the air, so it should pass through the nasal valve. Suppose in cases of inferior turbinate hypertrophy, or if there is any septum deviation obscuring the nasal valve area, so patient will have difficulty in breathing. He will present with the complaint of nasal blockage. I hope you understood. Let's look out with another diagram. This is a lateral view of human nose. So look out anteriorly. What you can see is, this is my upper lateral cartilage. Okay, and this is my lower lateral cartilage, which is also known as major LR cartilage. Okay, so my nasal valve is formed by this part of the upper lateral cartilage, then comes in midline is the septum, and laterally the inferior turbinate anterior most part. I hope you understood. Now what is Coatel's test? This is a test to check the nasal valve patency. How we do it? Just put your two fingers over the nasolabial folds. I put my two fingers over the nasolabial folds and I'll retract or push it laterally. If the patient feels any relief in the nasal blockage or the blockage get improves, that will check whether the nasal valve is patent or no. So that's how this Coatel test is done, and it is used for the nasal valve patency. Now similar name is Coatel's line. What do you mean by Coatel's line? It has also been asked in exam in the past years. So what is this line? The line drawn from frontal spine. Line drawn from frontal spine till the nasal spine inferiorly. So this is inferiorly nasal spine, above one is the frontal spine. So line drawn from this connecting these two spines is known as Coatel's line. What is the importance? Any deviation anterior to this line can be corrected by septoplasty alone. And if the deviation posterior to this So we can use either septoplasty or SMR, but in anterior it can be corrected by the septoplasty alone. So don't get confused between Cottel's line and Cottel's test.